by one. We know who you are. You'll know who we are. We accept most insurances, Medicare, Medicaid, and we're super convenient at 38th and Broadway by almost all the subways, trains, and buses. It's easy to get to us. We're going to stop for just a moment. We have a couple of voices that will tell you about the work we do, and we'll be right back to talk more.
For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. With Dr. Lederman, the radiosurgery pioneer, that's our goal too. He's first in America, first in New York, first for you. With Body Radiosurgery, we hit your cancer with no cutting, no bleeding. Dr. Lederman has decades of experience with primary and metastatic, large or small cancers from head to toe. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are best results and quality of life. Meet Dr. Lederman to hit the cancer. For a free booklet DVD, call 212-CHOICES, 212-CHOICES for a fresh second opinion. Most insurances, Medicare, Medicaid accepted. Not only super convenient, super Broadway and 38th in Manhattan. To hit your cancer, see Dr. Lederman, 212-CHOICES, 212-CHOICES.
With Dr. Lederman, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based on PSA, Gleason score, and stage. That's why Dr. Lederman's custom-tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Dr. Lederman's custom prostate cancer treatment is all outpatient. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid, accepted. Call Dr. Lederman at 212-CHOICES, 212-CHOICES for a fresh second opinion and free booklet DVD. Not only super convenient, super in Manhattan, 38th and Broadway. To hit the cancer, call Dr. Lederman, 212-CHOICES. Cherish your life. Custom prostate cancer treatment with Dr. Lederman, 212-CHOICES.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WOR Studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. You can also call Dr. Lederman at 212-CHOICES for a free informative booklet and DVD. Hey, Dr. Lederman, we're back.
Hey, we're back. It's Dr. Lederman, and it's Radiosurgery Hour. By the way, we have another show tonight at 9 o'clock on WOR. We have 5 shows every weekend on WOR, including a new show, which is going to be Saturday evening at 9 p.m., and then we have Sunday morning at 1:30 to 2:30 a.m., Sunday morning at 3 to 4 a.m., Sunday morning this show at 6 to 7 a.m., and tonight at 9 to 10 p.m. Because of a football game, we actually have another show this weekend, which will be at 11 to 12 p.m., and these are all unique shows. So if you're learning something, I know we have lots of patients, we have lots of public, we have lots of doctors tuning in. You're welcome to tune in whatever you want. We had another patient who was a 70-year-old woman. She's a widow. Came in with her son with severe pain. So she had endometrial cancer of the uterus cancer. She had surgery by robotic surgery. We've talked about robotic surgery. Well, unfortunately, it's another robotic failure surgery. She had endometrial cancer. She was told everything was contained. A week after surgery, she started leaking fluid in her both groins. She had drainage twice. She was rehospitalized. We talked earlier in the show about rehospitalization. Well, then she developed vaginal bleeding in September 2013. She had recurrence of the cancer. She had 6 months of chemotherapy. And then on chemotherapy, she had blood clots. And as I've talked about earlier on another show, actually the number 2 killer of cancer patients is not cancer, it's blood clots. So she's had cancer, she's had blood clots, she had this robotic surgery which didn't work. And now she has intractable pain. Even though she's had all that surgery and all the chemotherapy, she has intractable pain. And we found, she came into us, she's on multiple narcotics, multiple pain medicines. And we found actually the cancer's eating through her spine. Wow. So certainly that's something treatable. That's the kind of work we do with focused beam radiation. And most likely we can get rid of that pain. We can actually even stop the cancer and make the bone regenerate. So that should be good for her. We hope we can help her and hope we can speed her recovery in a good way. There's a man who came in this week, 63-year-old black man. He had a vasectomy in 1980. He is coming in because he heard there's a higher rate of prostate cancer and prostate cancer death in men who have had vasectomies. So he actually heard it on our program, and he came in to get checked out. And his checkup was fine, which is fantastic. He's also had decreased hearing, and we're going to check his hearing to make sure he doesn't have an acoustic neuroma, because unilateral hearing loss may be related to a tumor in the ear. Most people do not have that. So he got screened for prostate cancer because of a vasectomy and the increased death rate from cancer, prostate cancer, an increased rate of prostate cancer in men who have had vasectomies. He checked out fine, and he'll be seen on a regular basis, thank God. And here's another man, 48-year-old Hispanic man, came in with his fiancée. He had a colon cancer and spread to the liver. He had half of his liver removed. He had his colon removed, and now comes in with a spread of his cancer. It was already stage 4. When the cancer gets in the bloodstream, like colon cancer, and spreads to the liver, there's only one way to get to the liver from the colon, and that is through the bloodstream. Well, it's now, he was told it's in the lung, and we checked him out. We got him staged. There's actually only one area, and that's an area behind the aorta. Now listen to this. They were going to do bronchoscopy, so they're going to look in his airway to diagnose this mass. Well, this mass is behind the aorta. It's nowhere near the airway. So what they're thinking was to do bronchoscopy to biopsy a lung mass that was behind the aorta, where they could never get in a million years. It's like driving down Fifth Avenue to go to Cuba or something. You'll never get there. There's no connection between Fifth Avenue and Manhattan and Cuba. So why they would do it, I don't know. Luckily, he came to us. He's had lots of chemo, and he had neuropathy from the chemo. He had that surgery, and nevertheless, the cancer has traveled. He wants to have non-invasive treatment. He wants to have our treatment, and we are certainly going to offer that to him. He has a mass in the left lung behind the aorta. We can get to most any spot in the body, and we've treated, I can tell you, most any spot. I won't tell you the exact details, but you can imagine, and imagine whatever you think is the most difficult, and I can tell you that most probably we have the largest experience in the world treating radiosurgery. And this man, a lesion behind the aorta, measures up a couple centimeters. Most likely we can obliterate it without cutting, without bleeding, without the neuropathy from the chemo that he had before, without all that surgery. He does not want to have surgery, does not want to have chemo. He wants our non-invasive outpatient therapy. And there's another article out this month. Now, many women are choosing double mastectomies for breast cancer. And we're not talking about BRCA, which is a genetic condition. We're talking about the typical breast cancer. Many women, for unknown reasons, are choosing to have both breasts removed. Well, there's a study, and it was reported by Lindsay Tanner, that actually looked and confirmed that removing both breasts does not improve survival for women. And you can have lumpectomy and radiation and save the breast. Actually, that means you have both breasts for most women and have equal or better results. This was a study of 200,000 women in California looking at double mastectomies. There's just not a benefit, so we advise people, come on in, we'll talk about it, but you may want to talk about it before. It's always better to have all the information before rather than after. So we hope we can save you big operations, hospital stays, anesthesia, cutting, bleeding, and keep your body intact. Most people come to us because they want to keep their body intact. They want to live. They want the cancer controlled. and that's what we aim for. We see many women who have lumps in the breast and are just afraid to go to the doctor. They're afraid to lose the breast. Give us a call. If that's you, give us a call. Our number is 212-CHOICES. If you have a medical condition, call us at 212-CHOICES, which is 212-246-4237, day or night. If you want the booklet and DVD, just call us during the work week, and we will send it out pell-mell. We have 3 separate booklets. Brain tumors and brain cancers is one, body cancer is another, and then prostate with all the data from most major centers. So this is Dr. Lederman from Radiosurgery New York. We're happy to speak with you this morning. We hope you learned a lot. I sure did. Always learning something. Again, if you have questions, call us during the week at 212-CHOICES, which is 212-246-4237. Thank you, and God bless you. Bye now.
Thanks for tuning in to the Radiosurgery Hour with Dr. Gil Lederman and myself. If you have questions before next week's show or want a free informative booklet and DVD, just contact Dr. Lederman at 212-CHOICES. That's 212-246-4237. That's 212-246-4237. Till next week.
For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. That's Dr. Lederman, the radiosurgery pioneer's goal too. Dr. Lederman is first in America, first in New York, first for you with body radiosurgery. Dr. Lederman hits your cancer with no cutting, no bleeding. Dr. Lederman has decades of experience with primary and metastatic large or small cancers from head to toe. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Goals are best results and quality of life. Meet Dr. Lederman to hit the cancer. For a free booklet DVD, call 212-CHOICES, 212-CHOICES for a fresh second opinion. Most insurances, Medicare, Medicaid accepted. Not only super convenient, super. Broadway and 38th in Manhattan. To hit your cancer, see Dr. Lederman. 212-CHOICES. 212-CHOICES. 2-CHOICES. 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 2-CHOICES.